Having a child with a trach is definitely overwhelming at first, but you learn to create your new normal, and you realize that she's a child first, just like any other child, and she may breathe differently than you and I, but you know what? We all breathe the same air, and you learn that she isn't as different as everyone may think.
Having a child with a trach can be just normal.
A tracheostomy is a tube that's surgically placed in your neck, in your windpipe or your trachea, and it allows you to breathe through it rather than through your mouth and nose.
So the trach is a little tube, and ours connects to a ventilator, and it goes down and it breathes for her. And it just does something for her that her body is unable to do, and without it, she wouldn't be able to breathe.
Hi, my name's Tanner. I'm a respiratory therapist here at Primary Children's Hospital, and today we're going to give you tips and tricks on how to care for your child with a tracheostomy. There are two basic types of tracheostomy tubes, cuffed and cuffless. A cuffless tracheostomy tube is smooth. A cuffed tracheostomy tube has a cuff on the far end of the tube that can be inflated with water or air. To inflate the cuff, you will use the pilot balloon to fill with water or air. Please check with your provider to know which type of cuff your child has. All tracheostomy tubes come with an obturator. It is used to place the tracheostomy tube into the child. There are different ways to secure the tracheostomy tube. Trach ties that are a soft sponge and Velcro, twill tape, or chain. There are other parts or attachments to tracheostomy tubes. They include speaking valves, an artificial nose or heat moisture exchanger, a trach guard, caps or plugs, and a disconnect wedge.
We're going to go ahead and suction. We have our suction catheter here, and it's already marked to the depth that we need for his trach. We're going to take this catheter and insert it to the tubing right here. Then we're going to turn the suction on, and we're going to check the pressure right here to make sure that it's where it needs to be. Then we're going to insert. We'll slide the sleeve back like this, all the while not touching the suction, that part. I will keep my hand on the plastic part that covers it. We'll suction to this depth, we'll suction in, and we'll suction out, and then we will turn off the machine and be done. Okay. Come here, bud. Okay, you ready? Here you go. Here. Put it in. Good job. Okay, turn it on. Turn it on.
So I'll take her trach ties, scooch her up a little bit, set it behind her like that. then I take out her gauze. Oh yeah, I gotta make sure she's breathing. That's an important step. She's just killing at you. So this is just the Methylex gauze that we use. Some people use just like a regular slit gauze, but for Finley, this is a little wider, and I feel like it's just kind of cushioned. So I just get her Q-tips wet. I lift up her double chin, and I just go in there and try to clean out as much as I can. Lift up our chins, all of them. Hi, can you show look at Daddy? That came off perfect. I take one with one and I just dry it off. Then we'll have Daddy hold on to the trach itself, and I will reach back here and untie them. They're just little Velcro. So he's got a hold of it really good, so I don't have to worry about her wiggling as much. It's kind of a pain to get your fingers up in there. These things are really sticky. Okay. Then I would just, since we've propped her head up, it makes a nice little pocket that you can slide this out. And then we leave the new one there. Okay, and Dad's holding onto the trach, but he's also making sure to not put enough pressure on it that it makes her feel like she's choking. And then we just go into the side. Sorry, I can't get my finger in there. Here, switch hands. Thanks. I couldn't see. Okay, and then you just loop it around. You want to make sure that the trach stays centered, and then you want to make sure that your gauze isn't getting scrunched. So I pull all the way tight to the end here. Make sure the whole thing is Velcroed around. I can do it again on this side. Oh, good cough. So loop it right here, all the way to the end of it, and then go all the way around and make sure that it's secure there.
All done.
All done.
And then sit her up.
Oh yeah, and then I can sit her up. Yeah, right here. So if you scooch her up, the back of the trach ties have a little loop right here, another piece of gauze or another piece of Velcro. So you scooch your finger up underneath it and make sure that it's not too tight but not too loose. So this one is good. Come here.
First, I'm going to take that rolled blanket and I'm going to stick it right under the back of her neck so that I can make sure I have a clear view the whole time. I'm taking out the old gauze, and off to the side there I have everything laid out and ready to go, pre-measured. I'm going to make sure that it's nice and straight and check the obturator. I'm taking off the Velcro on each side of the trach ties so that it's nice and free. And I've got that new trach in my hand, and I'm gonna pop out the old one with my left and put the new one in with my right. Take out the obturator and connect her back to her ventilator. Now I'm going to take that pre-measured trach tie and attach it the one side at a time. I've found this to be the easiest way to attach them. Make sure that that trach tie is tight enough, and once you've done that, you can add that new gauze back in.
We're ready to do a trach change. We've got our hands washed and gloved up, and we've got a towel for under his neck so that we can change his trach out. We're going to go ahead and take out his gauze and remove the trach ties first.
Now I'm going to hold the trach in while she removes the ties. Oh wow! Excited about this today,
hold
huh?
still. Hey, hold still for a minute.
All right.
Lift up his head, pull the trach tie underneath, and then undo the other Velcro. I'm going to set this on my leg so that I can measure. I'll open up the brand new trach tie, pull it out, and measure according to the old trach tie. And adjust for length. This one needs to be moved about that far. And then I'll compare it to the old one again. I'm going to cut off this extra. So now I've measured and compared to the old trach tie. It's approximately the same length. I'm going to let that sit here. Alright, so we have our clean, sanitized trach in this bag. We're going to open it up. Very carefully take it out of the bag without touching the in-ear cannula.
That's a one-time use on the bag. We don't use that again.
Okay, so we have the obturator in here, and it goes all the way through the trach. So, Spencer thinks we tickle him, so we've got to be careful. Are you ready? Hey.
So I'm gonna take the dirty trach out, and then she'll put the clean one in, and it just slides right out.
We're gonna go ahead and use sterile water and put it on the trach. We're going to slide it right in and pull the obturator out quickly. Move your hand, bud. Move your hand, bud. So then we quickly pull out the obturator so that he can breathe. So now the trach's in. And then we'll connect the pre-measured trach ties that we've used, or that we've measured and ready to go. We stick them in this side, pull it as tight as you can all the way to the end of the trach tie and Velcro it tight. Secure it good. Then I'll lift up his head and put the trach tie underneath. Make sure it's not caught on his glasses or a hearing aid or his shirt. And then I will stick it through the little eyelet here and do the same on this side. Pulling it tight on the trach tie. We'll cinch it up right there and then Velcro it down on the trach tie. And we're done. Then we put in a new gauze, we clean around his trach and put in a new gauze.
And I'll replace his HME.
So this is a brand new gauze. Open it up. Open up our sterile water. Use a Q-tip to clean the bottom. He's got some junk that he's got here. Just make sure we clean it up good. Maybe. And then we'll dry it and make sure we get it cleaned up good.
We've used the other side of the Q-tip for the drying.
The wet side and the dry side. And then I'll use a totally different Q-tip for the top. We'll wipe the top, get it all wet, clean that side, and then we'll dry it with the other side. And that's all clean. Then we take out, we just use one gauze, and we tuck the gauze in, we split it like this, and then we'll tuck it right behind the trach. So I'll get my finger underneath the trach here, tuck the gauze underneath, all the way under, and then reach in and grab a hold of it and pull it down. And I'll do the same on the other side. Sorry, bud. And then we're done.
Emergencies come in many forms, from broken equipment to power outages to the need for rescue breathing and CPR. Create an action plan and know your resources so you're prepared. Always have your trach to-go bag accessible and fully stocked with supplies.
We've had a couple emergency situations. Luckily, they've been few. Lainey's had a couple trach plugs. They usually have happened in the middle of the night, unfortunately. We usually put some saline in her trach, try to loosen the secretions out, do some suctioning and some deep suctioning. And if that doesn't work, then we have had to change her trach, and eventually after doing that multiple times, she's been able to clear the mucus plug that she's had, and she's been able to, get the oxygen that she needs.
When we got the trach, the first couple of times it came out was a little bit of a panic. We kind of took it as an emergency, but you get used to it. Recently we had a time where we were sitting at the dinner table and he was in his high chair, and the breathing sound changed, and turned around to look at him, and he'd gotten a hold of the Velcro on his trach tie and was able to pulled out his trach and had the gauze in the other hand. We hurried and just grabbed gloves and were able to get it back in fairly quickly. Not a big emergency, it's just something that you get used to.
You will have already received American Heart Association Basic Life Support Training with mannequin practice. Now we're going to teach you the differences between assessing the airway with the tracheostomy tube and breathing. If you hear the monitor alarming, check the infant. Look at the lips and gums for color. Are they blue or pink? Look at the trach tube for kinking. Look at the chest for movement. Put your head near the tracheostomy. Listen for breath sounds and feel for breathing coming out of the tracheostomy. Try to wake the infant by rubbing their back or abdomen. You may flick the heels or rub the breastbone to cause the infant to cry and take a breath. Lay the infant on their back. Place a small roll under the shoulders to show the trach site. Check to see if breathing begins. If you are alone and someone else is home, yell for help and have them call 911. If you are alone, call 911 and return to the child. Attach the resuscitation bag to oxygen if available. Give 2 breaths. Watch for chest rise. If unable to get chest rise with the initial breaths, try to suction. Then try 2 more breaths. If still unable to get chest rise or unable to pass a suction catheter, change the tracheostomy tube. Once changed, give 2 more breaths. Check for pulse and signs of circulation. If there is no pulse, begin chest compressions.
A few tips of advice for a new parent with a trach is not to be afraid. There's been multiple people that I know that have fought off having a trach for their child, that their child's been in the hospital for extended periods of time, and they've said, as soon as I got a trach, it was like my child came alive again. It's amazing what your child can do when they can breathe easily and they're not fighting for every breath.
We knew it was the right decision after we did it, and she has never been happier. She breathes easier. She doesn't get air hungry anymore. She just doesn't struggle. She's really happy now, and we're happy.
We wondered how having a trach was going to affect everything from the daily routines like giving a bath and bedtime and dinner time and things like that, to playing with friends and activities, sports, going to school. And I want to say that a lot of that really depends on your perception of it. And the perception that you have and that the vibe you're giving off really is the biggest contributing factor to your child.
Quite honestly, Lainey having her trach has given her life and the quality of life that she's been able to have because of her trach. She wouldn't be here without it.